We're really excited to have Dan here today and to open us up with a presentation entitled Economic Vitality in a Data-Driven World. And we're going to actually start a video, and shortly after the video, I ask you to join me in giving Dan a round of applause. So we're going to start with this video, and then Dan will come up shortly after that.
Yeah, a couple. It's just great, right? We can do things differently and maybe even have a little fun along the way. Good morning. My name is Dan Pelino. Thank you for allowing me to be with you today. It's a true honor. I do run global public sector for IBM, so I have responsibility for all of our government, healthcare, education, and life sciences business. It's roughly 20 billion of our 80 billion as a company, and we have actually been on a little bit of a spending spree in healthcare. We have bought $4 billion of companies in the last year. You would know those as Explorus, Vitel, Merge, and then just recently Truven. So I'm delighted to be here with you. I'm really here under the guise, if you will, of three very specific focus areas. One, IBM, we spend roughly $2 billion a year in healthcare. We're self-insured. Many of you in the room help us with that, and that puts us in the top 5 spend in the U.S. And then when you take that globally, of course, that has implications when you have a little under 500,000 employees. Number 2 is I have some responsibility on advocacy. So some of you may know my colleague, Dr. Paul Grundy. We created the Patient-Centered Primary Care Collaborative. In 2012, we received the NCQA award for the work to try and drive towards quality, breaking that covenant and moving from fee to service into the quality metrics. And we all know where CMS is going with that and all the rate increases and the challenges that we have to try and drive quality, but we know it's in the right way. So we do spend a lot of time, I spend a lot of time on the advocacy positions, including some of the work that you may have seen recently with the announcement of HTA, this health alliance that started with 22 large employers and now is up to 28 large employers as we start to go on a quest to try and figure out how we as large employers can amplify our voice in this conversation of cost and quality that we already heard about. And then finally, I have responsibility for the business that we have, bringing solutions to many of you, and delighted so many of you, probably 80–90% of the audience here, you're clients of ours. So I thank you for our business, and it's our people, and many of them are here today that I'm so proud of, that we do what we do because everyone matters. And we're delighted to be the infrastructure partner, much of the analytics, the Watson work that's happening, and we're going to continue to go. That's why we've bought $4 billion worth of companies that we think help fill in those needs of before, during, and after, not just acute and episodic, but population health up front, and what you should do with aftercare behind that, before, during, and after within the experience. So it's my pleasure to be with you today. I do have some charts. Some of these are going to look a little bit like stock charts with solutions, et cetera. But I think more important is the dialogue that we're going to have. So if you don't mind, I'm going to flash up some charts just to give us a common baseline, if you will, and then we'll spend some time talking about what the issues are that are behind here. First of all, I have to share with you that I recognize that I am in the midst of some of the leaders in the world regarding healthcare in this room. In this room. And congratulations for what you've been doing and what you continue to plan to do. Given the role that I have, I actually have been working with many of you about expansions and things that you're looking to try and do. As a matter of fact, I was with Wegmans just recently, 2 weeks ago. They just brought a new store here, right, to Richmond. You're familiar? Shop Wegmans. It's great, pretty good, huh? It's a top 5 brand, period, and in its category, it's #1 and has been for a period of time. Danny Wegman is actually a pretty good friend of mine. He's just a tremendous individual, contributes much to the community, too. And he will tell you that he's a healthcare company first. He's looking to try and figure out what he should do with HTA, and as a large employer, what he wants. There's a message there, which is, all of you know this, but I'll just say it to make sure we amplify it. No one will accept the status quo. No one will accept the status quo. And people will look for options and alternatives, independent of current relationships. Independent of current relationships. That includes your large employers that are looking to come and continue to invest in your community right here. Now, having said that, you have such a wonderful opportunity. I actually picked up, you're probably wondering, you know, when you have these magazines out front, right, does anybody really pick one of these things up and look at it, you know? So you too could have one of these, it's out here. But what did I find interesting about it, which is this big league move, which is this conversation about corridors and what's going to happen with the expansion of corridors, and then the new relationships and the consolidations that will happen. And within those consolidations, how do you attract in time, talent, and treasures? And when you look, even in Northern Virginia, it's going to move from 8 million to 10 million people in Northern Virginia. Now, I must tell you, I drove down this morning. I was with the First Lady last night with for the kids, the hunger program, and which is, as you know, she's championing that. And it was a wonderful gala, raised a tremendous amount of money. So I was in Washington and drove down this morning. So I got up kind of early, and 95 going north was our parking lot. I got to tell you something. Holy cow. Waze was like, no. But fortunately, I came the other way. But this corridor, right, is this expansion of this corridor is going to be significant. And there'll be new partnerships that will emerge. And it is a big league move. And when you look at the map, and if you haven't, I would suggest you go pick this up. You can see other regions in the U.S. that are coming together. Now, let me tell you what you already know. Around the world, 75% of the world's population will live in cities. However, cities will be redefined. They will become regions that look just like this. And regions will redefine states, by the way. And these regions cross state boundaries. And so these partnerships, these consolidations, and these aggregation points, and these MSAs are going to change. So it's not just cost and quality, but it's actually economic vitality around 3 areas: infrastructure, citizen-based services, and education. Those are the 3 pillars that you have to get right in order to deliver on the promise of playing in the big leagues of having one of these monster regions. And if you don't, then you're behind. Then you're behind. You all know that. That's why you're all here. You all represent this great region that's here. Many of you have done wonderful work. I think Virginia, you all are on the dawn of a great new age for yourself of how you look at statewide services, how you come together. And by the way, I think you can even expand. You can look at Duke. You can look at Vanderbilt. You can look at Emory. The region itself gives you great opportunity. And if you're not as a group, somebody else is. Somebody else is. So against this backdrop of Virginia's for lovers, boy, I'd put it all together. Got to do the infrastructure stuff, get the roads white. Somebody's got to pay attention to 95. Got to make sure you got Wi-Fi coverage. Got to make sure you got water. Got to have the health systems. You got to have transportation. Got to have security. Fire, all those things, they have to come together. And then last but not least, you're sitting on wonderful education systems. Wonderful education systems. You attract the world to Virginia. I had a chance to be at UVA just the other day, and we were looking at the migration patterns of what's happening in Europe. You know, every day there's a significant movement of people. And what's interesting, when we studied it at the Batten School, it was where are they going, and then what are they going right by? Right now they're going right by all the Warsaw back countries. And they're going to places like Sweden, Denmark, Finland. Paris is full. Germany's still open. The UK is still trying to figure out, they're bringing them, but they say 4 years this, et cetera. But the world is redefining right now based on where people will go live. And it's going to have everything from weather patterns to how you handle the right kind of infrastructure. And if you only walk out with one thought, it's that you have a tremendous opportunity right now here within this region to do something really special. And I know it because I work with so many of you, and I work with your large employers, and I'm a large employer. So together, I think we can do some great things. Now let me take you through some other charts here. You all know these things that are happening. I just mentioned them about the movement of people, and there's a shortage of resources, and how many people are connected every day, and this is accelerating. So you know that. You wouldn't be here if you didn't think you had to figure it out. We're in this new era of computing, which is the cognitive era. So tabulating is where we started, where we counted things. Programmable logic, to my friends from Oracle and SAP and Microsoft, it was really all about taking what people did and make it go faster and scale and more reliable. So it was programmable logic. And then we signaled the era of cognitive, where you now have machine learning, and you have the ability to do things with things like Watson and others, where you can use machines to actually help you be far more predictive than you've been before. Look at patterns, read tremendous amounts of information, bring in best practices, looking for patients that are similar to me. Tackle things like oncology and cancer. These are all the things that we're starting with in healthcare. Now, what's important here is that you need the data. You need the data. So we're in this fourth generation of the Industrial Revolution. It's all about data. So when you look at the acquisitions that we've made, what am I looking for? I'm looking for large data sets. I'm looking for APIs. Why? More data, more open APIs. The smarter then I can run it against things like Watson and the work that we're doing, and I can take the risk out of what we do. We can shorten the time from discovery to treatment. We can look at best practices far differently. We can have everyone practice at the top of their license. And this is applicable across whether you're a payer or provider, whether you're a large employer, this idea of how am I going to use data and what's it going to do for me. I mentioned to you how important cities are. How you work together and what you do should be about smarter, not cheaper. And in the last 25 years, everything's been about cheaper. Stuff goes overseas, gonna outsource this, gonna try and aggregate purchases. There's still stuff that needs to be done. And I'll go through some of the solution areas just to give you an idea. Many of these things I'm sure you're working on. But it's gonna be how we're working together smarter, how we engage with the population differently. Now, one of the challenges that we're gonna have, and I must confess, I got here early. There were a few of you here. I was standing at the coffee area and looking around. It's interesting. So many of you have these great solutions, but there's going to continue to be consolidation here, right? So, and the consolidation is going to come around who can accelerate to scale to create the value with data that redefines the city, that attracts in jobs, that welcomes Wegmans with programs that might be engagement around wellness for their people. And I got to tell you something, if you could do it with Wegmans, with their margins, which are really very skinny, they're a grocery store. They're all about volume. So when you go to them with a wellness program, do you think they've got a lot of extra dollars on a per member, per month, per employee per month? No, your case has to be strong. And then you have to figure out how you scale it. And it has to have an engagement model that goes with it. The other thing that I find interesting is that many of the providers, the hospital systems themselves, the larger they are, they're looking at their cost to deliver care for their employees. You know what I'm talking about? So I'm talking about like the janitor all the way up to the surgeons. And they're looking at their cost factors, and they're trying to get their employees active, engaged, 5 normals, creating groups, and they're having great success. You may not know this. I mean, Bon Secours has done a great job with this. Numbers are published. UVA's on the same path here. Cleveland Clinic's on a huge path. Yale, New Haven, UCLA. I could go through the list. They've actually come together and formed an organization to share best practices. So in case it's not obvious to you, they're going to get their employee base right. And how do you think they feel about being put at risk without having the control in the market as a provider? First, you tell a doc, look, you got to do this EMR thing. And second of all, I'm going to put you at risk on your pay. And there's really no accelerator because CMS is only going to do like a 2% whatever. So as a provider, these guys get together, smart folks. They say, hey, why don't we do our own people first? And if this works, why don't we go out into the community and create our own MSA and put it at risk? See a lot of you shaking your head, yeah, holy cow. So if you're a health plan, you're asking yourself, uh-oh, how's this work for me? So as I stood out there earlier, you're all in a race. You're in a race to create that value across this before, during, and after. It will redefine this region. And large employers and others will not accept the status quo. I could stop right there. I'm 15 minutes into this. That's the most important thing that you got to go. You got to do it. You got to go. Because if you don't, somebody else is. So what would that somebody else look like? Could look like another provider that comes into town. Could look like Kaiser says, hey. Could look like the state says, we're not getting what we need. Could look like large employer says, let's go to Georgia. So the challenge is right in front of us. I know that's why you're here. It will redefine what we do, and it's about trying to be smarter as opposed to cheaper. I'm just going to go through a couple of these because you all are right spot on top of this. Health systems performance and optimization, take cost out. Cloud, being able to deliver now software as a service, be able to address all of these different aspects. I'm sure you're all working on these, including the mobility strategies that you have, how you engage at the hospital level. You have to have the right kind of infrastructure. You have to optimize. You got to take the cost out. Second is population health. What's in my Ketchum base? Now, you probably know this already, so forgive me for kind of going over some of the information you probably know. But when you look at information that's about all of us, only 10% of it is in a clinical dimension. Only 10%. It's kind of a disappointment with all the work we spent on EMRs, right? Oh my gosh, all this work, all this money, it's only 10%. 30% is on expression. So image, DNA, sequencing. 60% unstructured data, exogenous. Do we have access to fresh water? Do we have access to fresh food, vegetables, etc.? Behavioral aspects, 60% of the data. It was interesting last night at the gala to see who attended. It was just wonderful to see all the people and the progress that's being made for children to go to school and be fed. And the data shows just how well they perform or they don't. But you know what I didn't think about until last night? School's out for, see you in September. And I'm going to be really hungry then because they're not getting fed at home. They're not getting fed. So not only do we have to figure out how it works within schools, but we have to figure out how it works in communities. Here's an interesting data fact for you on this population health. The US, we all know where it ranks in healthcare. The fundamental difference, to find one fundamental difference between the US and the best performing countries in the world is a balance between how much you spend for acute and episodic and how much you spend on population health. We're not even close. We're around 25 to 27% spend on the upfront work. We're close to 75% on the acute and episodic. We wait for an intervention. We wait for it to happen. We leave it at the doorstep of the emergency room. We can't let that continue to happen. So some of you may have looked at my bio. I've done a lot of work with Patrick Kennedy now on this. Did the State of the Union on behavior and mental addiction. Most people think that that's 44 million Americans. No, that's the 44 million that we can count. Has nothing to do to see what the afflictions look like before. And now, working together, we've made some fundamental changes. You may have seen the changes on CMS. 2 or more comorbidities, you're screened for depression. Early childhood intervention, the initial meeting with the doc, they're going to screen on depression for kids. Testing. CPT codes are now going to allow you to get paid as a primary care physician. And on top of it, if you say you need a specialty EMR, CMS is going to pay for it. This whole upfront of the population health is exploding, whether it's wellness or trying to find people with afflictions and figure out what to do with them. I hope it's on your agenda. I really do. This whole individual thing, you know, the Fitbits and the keeping track of steps, being part of user groups. It's actually working, believe it or not. Within IBM, we've looked to see where we get the most traction, wellness programs. It's when people are encouraging each other. Cycling clubs, hiking clubs, running clubs, clubs to lose weight. And we've tried everything. You know, incentives have worked. I kind of chuckle a little bit about these incentives. So I turned 59 here July 1st. So do you remember when ATMs came out and you had a card and you'd go up, you kind of, is that your birthday? Is that what you said?
No, you're stealing my example.
Oh, really? Should I stop now? I go for it? All right, I'm sorry. We should probably talk ahead of time. So, but anyway, ATMs, you'd go up. You could have gotten a baseball cap. You could have gotten, you know, a Nats, whatever. You could have gotten 2 trips, American Airlines. You know, if they pull your number out of the hat, you know, continue to use it. Now, how much do they charge us? I'm not talking about Vegas. I mean, that's like $5-6, right? I mean, Jiminy Christmas. You need money in Vegas. That's a problem. You know, but literally, I mean, it's up to like $350, right? What's happening with health? We drove these types of stipends, and now we're going to charge you more. IBM charges you more. If you're smoking, we're charging. Toby Cosgrove at Cleveland Clinic wouldn't hire anybody if they smoked. See the behavioral movements here? I think you can see these kind of trends, and it's happening now at this individual level in the engagement piece. And the way to get at it, most of us believe it has to be, you've got to reach that individual in a way. By the way, I'm just going to somewhat be somewhat controversial for health plan, and you probably will have data that will tell me I'm wrong. These, EPA programs, the employee personal assistant programs that we as large employers pay for, that are somewhat voluntary. If you track that information about when an employee uses it, and if they continue to use it, what do you think happens? Oh, the utilization, right? One call, 2 calls, and then they don't return the nurse's call from the plan. I got this, I'm okay. Next stop, emergency room. We have to figure out a better way on this engagement and this insight here. And we know, as a large employer, we pay to have those kind of services. And what we're really looking for is getting our employees back to work and happy with their experience. End of story, control break. Turn the page. That's what we're looking for as a large employer. So I want to get to this productivity comment for a second. Global economies are not doing well. The folks at Harvard coined the BRICS, right? Brazil, Russia, India, China. You're familiar, right? BRICS. And the BRICS were supposed to grow exponentially for global companies and for world GDP. How do you think they're doing? So then the pressures on the mature markets get kind of growth. So everyone is looking for different options and new ways to save money and get efficiencies on productivities. So I must tell you, I think you have to look at the entire, your employees, the value proposition, how you attract in new employees, how you do incubators, how you do startups. New York's going crazy. You've been following what they're doing? Tax holidays like crazy. Tax and consumption will no longer fuel the needs of the people. Tax and consumption will no longer fuel the needs of the people. You've got to bring in new businesses. You've got to bring in the millennials. You've got to figure out how you get cost down. You've got to figure out how you engage. You've got to figure out how you do access across the region. You have to figure out how you do centers of excellence. And the reason is you're competing in a global world for talent. And if you're not careful, you'll be an exporter out of your world-class universities. You've got to figure out, how can I be an importer? How do I bring in more? So my time's up with you this morning. Thank you again for allowing me. We take this seriously as you do. Whether it's being a large employer, spending a lot of money, being with you on advocacy, such as you need to have a healer, the Patient-Centered Primary Care Collaborative, work that we're doing around the Health Alliance that you've heard about, to trying to bring you solutions, including, by the way, thinking that it's better if we aggregate some of these startup companies to give them more behind them where you think they add value, like an Explorus, like a Phytel, like a Truven, and then bring that information to you, large data sets, common APIs, and then helping you do what you do best. And Why do we all do this? I believe we do it because everyone matters. Everyone matters. Not just those that go to the emergency room, not those that have had a surgical procedure, but everyone. Everyone matters. Thanks for listening to me this morning. It's been a pleasure to be with you.